If you suffer from joint pain due to arthritis, Motrin Arthritis Pain 1% Topical Gel, a non-steroidal anti-inflammatory agent, Nsaid, could be a suitable option for you. It is used to relieve the pain associated with arthritis. It is important to talk to your doctor about non-drug treatments and other medications that can help manage your pain. When using this medication, it is important to follow the dosage instructions provided by your doctor. Additionally, it is best to apply the gel at the same time each day for consistent relief. Before using Motrin Arthritis Pain 1% Topical Gel, make sure to read the medication guide and patient instructions for use provided by your pharmacist. This medication is for use on the skin only, and to measure the right dose, use the dosing cards provided with the medication. Gently rub the medication into the entire affected joint as directed by your doctor, usually 4 times daily. Do not apply the medication on skin that has cuts, infections, or rashes. The dosage is based on your medical condition and response to treatment. Do not apply more than 16 grams of diclofenac per day to any single joint of the lower body, or more than 8 grams per day to any single joint of the upper body. No matter how many joints you are treating, do not use more than a total of 32 grams of diclofenac per day. To reduce the risk of side effects, use this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or use it more often than prescribed. If you are using this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. For certain conditions, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If your pain lasts or gets worse, make sure to tell your doctor. When using Motrin Arthritis Pain 1% Topical Gel, you may experience skin irritation or redness at the application site. If this persists or worsens, be sure to inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. It's also important to monitor your blood pressure regularly while using this medication, as it may cause an increase. If you notice high blood pressure readings, be sure to notify your doctor. Contact your doctor immediately if you experience any serious side effects, such as signs of kidney problems, symptoms of heart failure, or any symptoms of liver damage. While it is rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Non-steroidal anti-inflammatory drugs like diclofenac may increase the risk for a heart attack or stroke, especially if used for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. Avoid using this drug right before or after heart bypass surgery. It may also cause serious bleeding from the stomach or intestines, especially in older adults. If you experience severe stomach pain, black stools, or vomiting that looks like coffee grounds, seek medical help immediately. Discuss the benefits and risks of using this medication with your doctor or pharmacist. Before using Motrin Arthritis Pain 1% Topical Gel, make sure to inform your doctor or pharmacist if you are allergic to diclofenac, aspirin, or other NSAIDs. Also, let them know about your medical history, including asthma, liver disease, heart disease, high blood pressure, and kidney problems. If you have kidney problems, dehydration, heart failure, or are an older adult, you may be at a higher risk of experiencing kidney issues with the use of NSAID medications, including diclofenac. It's important to stay hydrated and inform your doctor if you notice a change in the amount of urine. Using this medication may increase your risk for stomach bleeding, especially if you drink alcohol and smoke. Limit alcohol consumption and stop smoking while using this medication. Be cautious of sun exposure while using this medication, as it may make the treated area more sensitive to the sun. Wear protective clothing and consult your doctor about using sunscreen. Older adults may be at a higher risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this medication. If you are a woman of childbearing age, discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, inform your doctor, as this medication may harm an unborn baby. It is not recommended for use in pregnancy from 20 weeks until delivery. If you need to use this medication between 20 and 30 weeks of pregnancy, use the lowest effective dose for the shortest possible time. Consult your doctor before using this medication if you are breastfeeding, as it is unknown if this form of diclofenac passes into breast milk. It's important to be aware that Motrin Arthritis Pain 1% topical gel can interact with other medications, potentially changing how they work or increasing your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Motrin Arthritis Pain 1% topical gel include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, other products applied to treated skin, and water pills, diuretics such as furosemide. Additionally, this medication may increase the risk of bleeding when used with other drugs that also may cause bleeding, such as antiplatelet drugs, blood thinners, and erlotinib. It's essential to check all prescription and non-prescription medicine labels carefully, since many medications contain pain relievers/fever reducers that are similar to Motrin Arthritis Pain 1% topical gel and may increase your risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. This medication should not be ingested. If someone has accidentally swallowed Motrin Arthritis Pain 1% topical gel, it can be harmful. If serious symptoms like passing out or difficulty breathing occur, it is important to call 911 immediately. Otherwise, contact a poison control center right away. Symptoms of overdose or swallowing may include severe stomach pain, changes in urine output, and slow or shallow breathing. If you suspect an overdose, seek medical attention immediately. It's important not to share this medication with others. While using this medication, it's important to undergo lab and/or medical tests, such as blood pressure, complete blood count, and liver/kidney function. Make sure to keep all medical and lab appointments, and consult your doctor for more details. In addition to using this medication, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises, may help improve flexibility and joint function. It's best to consult your doctor for specific instructions tailored to your individual needs. If you are using Motrin Arthritis Pain 1% topical gel on a regular schedule and you miss a dose, apply it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and use your next dose at the regular time. Do not apply double the dose to make up for the missed one. Make sure to store Motrin Arthritis Pain 1% topical gel non-steroidal anti-inflammatory agents, Nsaid, at room temperature and avoid freezing it. Keep it out of reach of children and pets. When it is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.